Welcome to this educational program. This module discusses Visudyne treatment for an eye disease called age-related macular degeneration, or AMD for short. There are other modules available that describe other aspects of AMD. This information is taken from a recent review of the medical literature and aims to be as transparent and comprehensive as possible. However, it may not necessarily reflect the experience of your healthcare provider or the specifics of your situation. This program is strictly informational in nature, and no attempt is made to provide opinion or recommendation. Please feel free to view this presentation as many times as necessary. You may also use the player on your left to repeat slides or to skip through them in any order you wish. Age-related macular degeneration, or AMD, is an eye disease that may cause central vision loss. It affects the macula, the center of the retina at the back of the eye. Vision loss can affect quality of life, productivity, and employment. It can alter your ability to perform certain activities and can be emotionally challenging. You may experience shock, anger, sadness, loss, or depression, and living with AMD may necessitate lifestyle changes that could be difficult. Generally, AMD does not cause total blindness, as it affects only your central or straight-ahead vision and leaves your peripheral or side vision untouched. Lifestyle changes, vision aids, doctors, and your family and friends can all help you deal with vision loss. Adapting to living with AMD and preserving your independence are possible. Researchers still do not have a cure or prevention for AMD. Until a cure and prevention are found, delaying the disease and lowering risk are the critical strategies for preserving vision. Current treatment strategies for AMD are aimed at slowing the vision loss. Unfortunately, there is no treatment available at this time that can actually improve vision. There are two types of AMD: dry AMD, or early stage, and wet AMD, or advanced stage. Dry AMD is the most common form, accounting for about 90% of patients. It is a slowly progressing thinning or atrophy of the macula. When the delicate tissues of the macula become thin, they stop working well. As a result, vision is blurred. The wet or advanced form of AMD is less common, accounting for only about 10% of cases, but it is more damaging. Wet AMD can develop rapidly and cause severe vision loss. The process of diagnosing AMD begins with a careful eye exam by an eye doctor, who will take a detailed look inside your eye and look for signs of AMD. Your doctor will refer you to a specialist if he or she suspects you have AMD. The specialist will further examine you with a dye test called a fluorescein angiogram, take some imaging inside the eyes, and determine what type and stage of AMD you have. If the specialist diagnoses dry AMD, he or she will discuss how to manage the disease. Managing dry AMD involves regular monitoring of vision, possibly lifestyle changes, and the use of visual aids. There is no treatment for dry AMD at this time. If your doctor diagnoses wet AMD, on the other hand, you will likely discuss treatment options. For the most part, wet AMD can be treated, and its treatment targets the abnormal bleeding vessels at the back of the eye. Some types of wet AMD respond to treatment better than others. Therefore, your eye doctor will advise you on what particular type of treatment is most appropriate for you. Of the various treatments for wet AMD, the two preferred treatments are Photodynamic Therapy, or PDT, and anti-angiogenesis. Both treatments have been clinically tested and proven to be effective and safe. Other therapies include those that are currently being tested, some that are just starting to be explored, some that are inconclusive, and some that are outdated. Which treatment recommended to you will depend largely on the type, stage, and location of your AMD. Photodynamic therapy, or PDT, is a painless 30-minute procedure done in the eye surgeon's office that targets the abnormal leaking blood vessels at the back of the eye. It is a 3-step process that uses a drug activated by a laser. First, the drug is given to you by injection, slowly, over about 10 minutes. Once it is in your blood, the drug travels through the circulation and reaches the eye. Next, the eye surgeon shines a low-intensity, non-heat-producing laser into your eye for about 90 seconds. When this laser comes in contact with the drug, it reacts with the drug and activates it. Finally, the activated drug seals the abnormal blood vessels without damaging the healthy surrounding tissue. The PDT procedure is called Visudyne therapy, and it uses the drug verteporfin. Visudyne therapy is a multi-course treatment, meaning you would be treated multiple times. Typically, Visudyne therapy is repeated every 3 months or so. How often treatments are repeated will vary depending on your particular needs. The goal of Visudyne therapy is to stabilize your current level of sight, not to restore it. Indeed, studies have shown that AMD patients who complete a full course of Visudyne therapy are more likely to preserve their vision than those who have no therapy. Please discuss the effectiveness of this treatment with your eye doctor. For a few days after therapy, both your eyes and skin will be sensitive to sunlight and bright indoor light. It is recommended that patients wear long-sleeve clothing, a hat, and some sunglasses during the first few days after treatment. Interestingly, sunscreen does not protect against this photosensitivity. As with any treatment, there are possible side effects associated with Visudyne therapy. Patients might experience pain or swelling at the site where the needle was inserted. They may have some back pain during the 10-minute injection. They may experience some blurred vision. Or they may have some vision loss. Please discuss the possible side effects of treatment with your doctor. There are other treatments available for wet AMD. Please consult your eye doctor to discuss treatment options. AMD can greatly impact quality of life. Depression is one disabling effect of AMD, and patients are sometimes encouraged to seek psychiatric care for depression. Support groups can help patients cope with vision loss through sharing experiences with others who are similarly affected. Would you like to know more about treatment for AMD? Researchers are actively looking for new and better ways to prevent and treat this condition. For more information about research on emerging treatments, visit www.blindness.org. You may also visit this website if you would like to take part in a clinical trial for treatment of AMD. Other modules in this series include Understanding AMD, Lowering Risk of Developing AMD, Dry AMD, and Wet AMD. There are numerous resources to educate you and help you cope with AMD. Here are a few of them. AMD Canada, the American Academy of Ophthalmology, the Canadian Ophthalmological Society, the Canadian Association of Optometrists, the National Coalition for Vision Health, the Eye Club, and the Canadian National Institute for the Blind. Here are some more resources which you may find helpful. We sincerely hope that this module has furthered your understanding of Visudyne treatment for AMD. We wish you the best for the future, and thank you once again for viewing this educational program.